Mahopac. You're watching News 12. Local matters.
June is Men's Health Month, and to raise awareness about serious health issues, including heart attacks, heart disease, and diabetes, we have Dr. Douglas Hart, the director of Echocardiography at White Plains Hospital, to speak to us about what men should be doing this month and always. Dr. Hart, you don't make up the name. Tell us a little bit about what the men need to look out for.
Good morning. Thank you for having me. Men and women alike are at risk for heart disease and other illnesses, and so much of what can be done to prevent these things have to do with our lifestyle. Eating a healthy diet, exercising, and getting regular health screens can have a significant impact on your risk of heart disease.
But I agree with your approach, Doctor. Offline during the break, we were saying it can't be all or nothing sometimes because people aren't inclined to follow that always. You need to find balance. Exactly.
I am a big believer in balance. I find it hard to prescribe a diet that's very strict and makes it almost punishing for patients. Plus, there's a lot of cultural variations in the way people eat. And when you look at a standard healthy diet and they put a plate of plain looking salmon and a few spears of dried broccoli and brown rice, it doesn't seem very appealing. But you can spice that stuff up using all kinds of flavors, herbs and spices and chili oil and various ways of making food flavorful without adding a lot of salt and without adding a lot of fat and extra calories. And when you add lots of flavor, you tend to get satisfied more readily than when the food is more bland, and maybe you won't eat as much.
If you were trying to, and I know this, of course, is circumstantial based on each individual person's current needs, but what screenings should men really be prioritizing? What should they be putting first?
Well, men should, see a doctor every year or two, depending on your age. And it's important to know what your cholesterol profile looks like, not just the total cholesterol, but the whole panel, and to review that with your doctor. There are other specific lipid tests, such as a lipoprotein A level, which could be useful. There is a test called a C-reactive protein, or CRP, which also can be helpful in adding to the risk profile for cardiovascular disease. But everyone should also be checked for diabetes, maintain an optimal weight as best as possible, have prostate checks, colon cancer checks, skin cancer checks on a regular basis.
And of course, White Plains Hospital can help with all of that. I think the other battle you're always up against is just simply getting them in the door, right? Encouraging them that it's the time to do it. You have to do it, not only for yourself, but for your family. Dr. Hart, thank you for the time this morning.
It's my pleasure. Have a good day.